are dental students from University of the East College of Dentistry. As for our college mission, imploring the aid of divine providence, the University of the East College of Dentistry dedicates itself to the service of the youth, country, and God, and declares adherence to academic freedom, progressive instruction, creative scholarship, goodwill among nations, and constructive educational leadership in dental education. Inspired and sustained by a deep sense of dedication and compelling yearning for relevance, the University of the East College of Dentistry hereby declares as its goals the preparation of young men and women for the general practice of dentistry in order to develop their competence in the maintenance of oral health, to enhance technical skills and digital dexterity of students, and to instill proper attitudes with a strong commitment to the ideals of the dental profession. And as for our college vision, the University of the East College of Dentistry is envisioned to be recognized as Center of Excellence in Dental Education by Commission on Higher Education, and eventually to be known in the international dental community for its world-class globally competitive graduates and state-of-the-art facilities. Thus, the college will become a destination of choice for all aspiring undergraduate and graduate students in dentistry, not only in the Philippines, but worldwide as well. For today's topic, imagine how difficult it is to lose your sense of sight. How challenging it will be to go on with your daily life without seeing. If your sense of sight is on the line, will you, do, or I? We are Group 8. As presenters, our goal is to present a case of glaucoma discovered in UERM Infirmary, to understand the scope of those with glaucoma, to raise awareness of this disease, especially when making rounds in the infirmary. For the subjective part, patient DP is 55-year-old male, a Roman Catholic from Mandaluyong City. His birthday is on March 11, 1964. With a dental chief complaint of umuuga ang mga ngipin ko, and the medical chief complaint, blurring of vision of 1 month duration. For the dental history of present illness, 5 months prior to consultation, patient complains of hypersensitivity on his anterior teeth. He noticed this while he was brushing his teeth. He recalls to have not felt any pain. No medications were taken. No consultation was done. 3 months prior to consultation, patient complains of hypermobility on his anterior teeth. He noticed this while he was eating lunch. He checked to see that the gingiva on his anterior teeth was inflamed. He recalls to have not felt any pain. No medications were taken, and no consultations were done. 1 month prior to consultation, the patient noticed that the gingiva on his anterior teeth was bleeding while he was brushing his teeth. He also noticed that the gingiva was inflamed. Hypermobility of his anterior teeth was still present. He recalls to have felt pain during mastication. Patient self-medicated by taking mefenamic acid, 500 mg. On the day of consultation, the patient still feels pain upon mastication. Hypermobility was still present on his anterior teeth. His gingiva was inflamed. He claims to still experience bleeding while he would brush his teeth. He was still taking mefenamic acid, 500 mg, every time he experiences pain. He was admitted to the UERM Infirmary. For the probable oral manifestation of a patient with this condition are xerostomia, dental caries, gingivitis, periodontal disease, increased tendency to oral infections, burning mouth, taste difference, and poor wound healing.
For the medical history of present illness, 1 month prior to admission, patient was lying down when he noted dust allegedly entering his left eye, described as parang napuwig, associated with mild redness and pain. Patient was brought to a clinic in Marinduque wherein his eyes were clean. 2 to 3 days later, intermittent blurring of vision was noted. Upon waking up, patient noted difficulty seeing faces, but this would resolve spontaneously. 3 weeks prior to admission, due to persistence of symptoms, patient went to Manila for consult. Patient was advised by his physician to undergo P-scan at UERM Eye Center and was prescribed with sodium hyaluronate eye drops, which the patient took with good compliance. Patient was also advised that he should undergo cataract surgery on the left eye. 2 weeks prior to admission, patient noted eye pain with PS 7 to 8/10 associated with blurring of vision, photosensitivity, tearing, and gritty feeling of both eyes. Patient sought consult at UERM Ophtha OPD for reading of P-scan results and to ask for second opinion regarding cataract surgery. Patient was managed as a case of neovascular glaucoma for both eyes and for his left eye, posterior vitreous detachment. The patient was prescribed the following medications: latanoprost eye drops, 1 drop to both eyes once before bedtime; moxifloxacin or Vigamox eye drops, 1 drop to both eyes 3 times a day; dorzolamide eye drops, 1 drop to both eyes 3 times before bedtime; Combigan eye drops, 1 drop to both eyes 2 times a day; K-Lite tablet, 1 tablet 3 times a day. Patient took all medications with good compliance, and patient noted temporary relief from his symptoms. 5 days prior to consult, patient went to UERM of the OPD where pan-retinal photocoagulation was done and anti-VEGF injection was given. Previous medications were continued with good compliance. 4 days prior to consult, patient noted relief from eye pain but noted worsening blurring of vision associated with excessive tearing and foreign body sensation of both eyes. Patient applied the prescribed eye drops which did not provide relief of symptoms. Patient sought consult at UERM of the OPD where he was advised admission for eye surgery. The following medication were added: 1. Atropine eye drops, 1 drop to each eye 3 times a day; 2. Predforte eye drops, 1 drop to each eye 3 times a day. Patient was also given 1 tablet of acetazolamide. Patient noted temporary relief from eye symptoms. On day of consult, signs and symptoms persisted. Patient then went to DDRM Eye Center and has subsequently admitted for the following procedure: phaco emulsification with PCSOL implantation and glaucoma drainage device implantation for his left eye under general anesthesia. As for the patient's social history, he was a 4-pack-a-year smoker, occasional alcoholic beverage drinker, and denies illicit drug use. As for the review of systems, these were his results. For his skin, negative in dryness, change in hair and nails; eyes, negative in redness, pain, blurring of vision, discharge, and trauma; for his ears, negative in discharge, tinnitus, otalgia, hearing loss, and swelling; for his nose, mouth, and throat, negative in colds, cough, anosmia, discharge, dysphagia, odynophagia, toothache, dental caries, gum ulcerations, and epistaxis; for his respiratory, negative in hemoptysis, dyspnea, shortness of breath, difficulty of breathing; for his cardiovascular, negative in palpitations, chest pain, orthopnea, and syncope; for his gastrointestinal, negative in fatty food intolerance, nausea, loss of appetite, diarrhea, hematoxesia, melena, indigestion, stool incontinence, and hematemesis; urinary, negative in frequency, dribbling, retention, hematuria, negative in hesitancy, nocturia, and dysuria; for his genito-reproductive, negative in bleeding, pain, and discharge; extremities, negative in cyanosis, varicosities, ulcers, claudication, and edema; for his hematopoietic system, negative in anemia, pica, and epistaxis; for his nervous system, negative in dizziness, tremor, fainting spells, seizures, trauma, and headache; for his musculoskeletal, negative in back pain, joint stiffness, pain, swelling, muscle weakness; and for his endocrine, negative in neck surgery or irradiation, polydipsia, and polyphagia. Now for the objective part. The patient's general appraisal was: he was awake, alert, coherent, conversant, not in cardiorespiratory distress on the day of consultation.
His physical examination for his head, ear, neck, and throat, anecteric sclerae for both eyes, pink pulpoperic conjunctivae, both eyes, no cervical lymphadenopathies, and no tonsillopharyngeal congestions. As for the patient's ocular exam, these were the results. So for the visual acuity of the left eye, LP, eyebrow symmetrical; for the eyelashes, negative to matting; for the eyelids, negative pulses and lacerations; for the sclerae, hyperemic; for the cornea, it is hazy; conjunctiva, it was pink; for the pupils, it was 3 millimeters SRTL; for the iris, they were brown; for the anterior chamber, it was shallow to deep; lenses were with opacities; EOM was full; for the fundoscopy, it was fair or OR; tonometry, it was firm; for the right eye, for the visual acuity, it was LP; for the eyebrows, it was symmetrical; for the eyelashes, it was negative to matting; eyelids were negative to pulses and laceration; the sclerae were hyperemic; for the cornea, they were hazy; conjunctiva was pink; pupils were 3 millimeters SRTL; iris were brown; anterior chamber was shallow to deep; Lenses were with opacities, EOM was full, fundoscopy was fair or OR, tonometry was fair. As for the rest of the patient's physical examination, these were his results. For his lung and chest, equal chest expansion, clear breath sounds, and no retractions. For his cardiovascular, a dynamic pericardium, normal rate, regular rhythm, distinct S1, and negative 2 murmurs. For his abdomen, flat and non-distended abdomen, it was also normal active vowel sounds, soft and non-tender. For extremities, FEP, SRT less than 2 seconds, negative to edema, and negative to cyanosis. As for the assessment, the patient's diagnosis are the following: immature cataract on left eye and neovascular glaucoma on left eye. Now for the plan, the following diagnoses were done by the patient: ECG, chest X-ray, BCB, spot CBG. As for the patient's dental treatment plan, he is advised to have the following: oral hygiene instructions and scaling and root planing. As for the patient's medical treatment plan, he was advised to have the following: phacoemulsification with PCIOL implantation and glaucoma drainage device implantation. We have found a journal which is about the dental status those who have diabetes, which we think best support our patient's case. The journal is entitled Oral Health Knowledge, Attitudes, and Care Practices of People with Diabetes, a systemic review by Podell P. et al. It was published on 2018. It was mentioned that people with uncontrolled diabetes are at greater risk for several oral health problems, particularly periodontal gum disease. Periodontal disease also impacts diabetes control. Good oral hygiene and regular dental visits are recommended to prevent and manage oral health problems. Several studies have been conducted to assess the oral health knowledge, attitudes, and practices of the people with diabetes. Yet, a review of these findings have not yet been undertaken. The aim of this systemic review was to synthesize current evidence on the knowledge, attitudes, and practices of people with diabetes in relation to their oral health care. As for our experts' opinion, we were able to acquire ample knowledge and information provided by one of our very own supervisors from the oral surgery department, Dr. Pisano. These were his thoughts about the subject matter. And I quote, "Patients who have diabetes have friable blood vessels, so nutrients reach the site of extraction slowly, thus delays wound healing. Infection is also increased in this patient. These are what we have to watch out for. For antibiotics, normally we don't give antibiotics to patients who will undergo extractions, provided that there is no infection within fascial spaces and their immune system is not compromised. However, diabetic patients are considered immunocompromised. Therefore, antibiotics and prophylactic drugs should be considered depending on the severity of the diabetes and the procedure. Glaucoma is associated with diabetes, so not much is done with this other than to manage the diabetes. Epinephrine constricts the blood vessels. In a diabetic patient, their blood vessels have plaque buildup, therefore increases the pressure and potentially can form a thrombus, embolus, and eventually clogs an area, leading to necrosis." End quote. And with this, we end our presentation. Thank you for listening.